Public health is one of the greatest things in which a government can invest. Early prevention, which is relatively inexpensive, can prevent dire and expensive healthcare problems later in life. Governmental responsibilities for public health extend beyond voluntary activities and services to include additional authorities such as quarantine, mandatory immunization laws, and regulatory authorities. Carrying out the public health mission requires systematic identification of health problems or barriers and the development of means to solve those problems. Apart from lack of consensus on the content of the public health mission, inadequate capacity to carry out the essential public health functions of assessment, policy development, and assurance of services, disjointed decision-making without necessary data and knowledge. What are those barriers to effective action? Today on your regular health TV talk show, The Physicians will be discussing public health as a problem-solving activities, barriers to effective action. Stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agberian, your regular anchor on this program. Today we'll be discussing public health as a problem-solving activities, barriers to effective action. In the studio with me, I have one of my regular guests, very cerebral public health physician. She's no other person than our very own Dr. Alero Roberts. She is a consultant public health physician with the Lagos University Teaching Hospital. And welcome again to our program.
Thank you, and thank you for still tolerating me and having me on.
You know we can't do without you, Dr.
Oh,
Alero.
bless you.
You're a public health guru. Each time I remember Professor Ransom Kuti, you always come to mind.
Oh, thank you,
thank you.
Great teachers, yeah. Great teachers. I pray that we've left that, we keep that legacy going.
By the grace of God, we should be able to do that. That is why we are here as public health physicians. Okay, so what we're talking about public health as a problem-solving activities, the barriers to effective action. First, for our audience to know, what is public health?
Aha! I knew you were going to ask that question. You know, Dr. Agberian, you like asking jam questions. So, despite the name public health, many people will be shocked to find out that it encompasses engineering, journalism, water sanitation, law and legal infrastructure, governance, even before you get to the health sector, education, ever before we get to the health sector. Okay. There's transport, there's security.
So that is everything.
So it is everything to do with what will impact the health of the public.
Okay.
What we eat, so there's agriculture in there as well. Okay. There's transportation in there as well. All the legal frameworks for ensuring food security on a national, down to a household level, is all involved in public health. So despite the name public health, doctors and nurses really have very little roles to play if everything else does not come
when
together.
You talk about public health, what really comes to mind most times is the doctors that give vaccines.
That is where everybody's mind starts and stops. That is where everybody's mind starts and stops. So even what we are doing now, bringing awareness to so many different issues, is part of the public health. Because there are some people who will not even listen to a doctor or a nurse, but would listen to their teacher, would listen to their clergyman, to their imam, would listen to a trusted community voice, ever before they listen to doctors. So communication is a key strategy. Public health also includes the sociology of human behavior. So you've got the psychology of it, you've got the sociology of it, you've got the economics of it. All of that is embedded in that one term.
No wonder medical school is actually a very big...
This is it.
Yes.
And now it's becoming, in many universities, is a standalone faculty. Okay. People can go in and do public health as an undergraduate, master's, postgraduate degree. Okay. Because it involves everything.
Wow, it involves everything. And you have enlisted so many areas of which is involved. Now we want to talk about the problems or the barriers that are usually encountered. So how do you want to just break this down?
Well, when you look at it, you've got challenges of public health in what I would call an increasingly complex and interconnected world. Remember we said transportation.
Yeah.
Transportation isn't just Lagos to Yanokwaja. Transportation isn't just Lagos to Maiduguri or Sokoto. Transportation is also, do you remember what they said when Ebola hit Lagos?
Sure.
Somebody said, ha! Whoever wanted to hear Ebola and Lagos in the same sentence. So now we are talking English grammar.
Yeah.
You know, because Lagos is a hub of international travel. Our people are everywhere. So when we think of that increasing complexity and interconnectedness of the world, we need to be very sure of what we're doing. So it's not just a field of study or practice. It is actually the cornerstone of social and societal well-being. Okay. That's what we need to remember. And in protecting the health of populations, that's where public health comes into it comes into its own, literally. And this is where we need to pay attention to what are the barriers to effective action. What is it that we are not getting right? What is it that we need to address?
Okay. So do you want to have the floor?
So, you know, when we're looking, you know when you send me this topic, I represent an entire association, so I have a wealth of knowledge and experience I can call on, both within the Lagos chapter and the national body. So, of course, I called on a few people and said, okay, what can we, and the back and forth, and everybody is chipping it in. But we identified 5 key barriers. Chief, money.
Money.
Or let me expand that a little. The lack of adequate resources. Okay. Adequate resources, you know, is not just money, materials, MMM, the 3 M's. I remember my teacher, Professor Shibogu. I hail, sir. I hail the 3 M's. Money, materials, men. So men is mankind, everybody. Yes. So when we know that we are suffering the effects of decades of underfunding of the educational and health sector, which is why we're seeing a system where we've got both inadequate resources and misapplied resources. Of course, poor infrastructure, human resources for health, rapidly depleting. And we have to determine all that. Then we are talking about health inequities. And our health inequities are persistent, and they are driven by social, economic, political factors. But what we find is that we haven't got, we need those, the principles of equity, fairness, and justice, okay, to be able to access and deliver safe and effective health services. So it's one thing to be able to deliver safe and effective health services, but it's now inaccessible to any proportion of the population, particularly those who need it most. Then we have this fragmented approach to the health sector. The health sector has become anybody's sector. Okay. And it's actually, even though I said public health is more than just health, you find that you've got it fragmented in different areas, which has allowed NGOs and donor organizations and whatnot to come in and set up vertical silo programs. Everybody is doing their own. I belong to this organization. I'm doing this organization. And you've got a disparate array of agendas that don't always coincide or co-align with what the government wants to do. Then, of course, we've got resistance to evidence-based practice. And you are well aware of that. The so-called myths and misconceptions, which is a major thing we are still dealing with. It's a big problem. It's a huge problem. It's a huge problem. We dealt with it from women, maternal mortality. We're still dealing with it. We dealt with it through the COVID period. We're still dealing with it now with rollout of a HPV vaccine, and we're still going to have to talk about that at some point. You know, where people believe these myths and misconceptions that are dreamt up by people who have no business talking about anything in health.
Even this HPV vaccine, what is even amazing is some people just pushing just social media, of course.
Yes, but the pity about it is that when the girl or the woman now develops cervical cancer and goes to try and access much needed health care, Where are the social media influencers to help her pay for that healthcare?
Exactly.
You made sure she did not get the safe and effective prevention free. But when push comes to shove,
government is actually trying this aspect in trying to enlighten the public. Let them know.
We need to do more.
Of course,
Martina, we need to do more. We need to do more. We need to do it constantly. Because this is what we're talking about, the barriers to effective action. When we are talking about this misinformation, we're talking about vaccine hesitancy, we're talking about this resistance to evidence-based practice. This reflects on our poor educational foundations. That's just the truth of the matter.
Makers, like talking about the traditional rulers.
Well, even before you get to those gatekeepers, but they're part of it. It's true.
Religious.
What were they taught? I mean, how could we come to COVID in 2020 and be reteaching people how to wash hands when hand washing was an integral part of everything we did when we were growing up? You got into school, same thing. You went out for break. Everything was there. It was taken for granted. And when you teach children in that way, they do not depart from it in adulthood.
Where did we get it wrong?
Where did we get it wrong? How can we be discussing hand washing? I remember it was a concept so alien to me in about the 2015, 2016 era when they would say, oh, we have to talk about hand. I said, hand washing? Doesn't everybody wash their hands? Apparently everybody was not washing hands. We were going to primary schools that had no running water. We were going to clinics that had no running water. So when we have lost such fundamental things, then you realize what a big problem we have dealing with myths, misconceptions, vaccine hesitancy, and this lack of, this resistance to evidence-based practices.
Wow. Dr. Alero, I think the problem is actually very enormous. Because from what I actually see here, I also have this disjointed decision-making without necessary knowledge.
Yes, this fragmented approach. Everybody coming in to do their own. Oh, Nigeria is a country of 200 million Nigerians. So, therefore, if I come in and do this, and X number of people sign on to it, my money has been made. Governments need to invest. Okay. But if we don't call them to be accountable, then they invest money and it goes to spurious agendas.
Is it only government that should invest? How about the private sector?
Even if the private sector invests, it mustn't do so in, what do you call it, apart from what the government agenda is. So there has to be one collective agenda. Because yes, private sector has invested. And we've got beautiful, I won't even call them 5-star hospitals. I'll call them 7-star hospitals. Beautifully equipped and whatnot, out of reach for the majority of the population. That is fine. Private sector attends to private sector. But what about the rest of the population?
How about individuals?
Even the individuals themselves. And in any case, government has to provide the investment for developing a skilled workforce. Okay. Government has to provide that investment. We're talking, that segues straight into what I call the health inequities, where the best trained want to remain in the highbrow areas of the cities, and the majority of the population can do what? Do you understand what I'm saying? Right. So you now train all this health workforce, and they all want to stay in the cities where the grass is greener, or go to other cities where the grass is greener.
So why won't government have a policy?
We do have these policies.
Why it's not been implemented?
Because we're not calling them to order. We do have these policies. You know, I've said it on this program many times. There's not a single policy in health that we do not have a Nigerian version of. They are just there in the ministry.
So whose responsibility is it?
Ours as our people, as a people. We need to educate ourselves on what our rights are and make sure we're calling the government to order. There's an LGA I'm working in right now where they have called the local government chairman to order on 1 or 2 things. And it's working. The man is now forced to go and make sure that the funds are made available and the services provided and the activities taken. We need to promote health literacy.
So I think the onus is actually on us.
It is on us as a people.
Because if they don't know, they won't be able to.
They won't exactly what I'm saying.
We need to let them know that these things are supposed to be done.
Call them yes, and we know. I mean, because to be honest, the budget is printed. Isn't that how we got to know about certain items in the budget that there was such a public outcry about, and then government had to backtrack and say, oh, okay, they're not doing it again? The budget is actually in the public domain. Do people go and read it and say, come? But if they have assigned, because the question I kept asking is that last year this was a budget item, 2021 this was a budget item, 2020 this was a budget item. Why is it still a budget item in 2023?
People are not just interested in what is going on.
People don't know that they need to call government to order. It's not every time it's voters card, go and vote. That's only once in 4 years. On a daily basis.
Or you think they have lost confidence?
Even if you lose confidence, if you're not interested, will you die on that hill? Is that something to... Must you go and die on that hill? You can't lose confidence. I have lost faith in government. It is true.
Many people actually know that local government chairperson.
Isn't it a challenge we've put out here before, Dr. Martina?
I agree. I know.
I've asked you, do you know the name of your local government chairman? Do you know where the nearest PHC, if anybody in your house gets ill while you are here doing this program, do they know where to go, who to call, apart from you?
Yes, at least I gave them the numbers.
That's
yes.
I
know the importance of primary health
exactly,
care.
And then we are
very close to my house.
Exactly. Exactly. So that's the first port of call for everybody in my house, and in fact in my neighborhood. I'm like, go there first. If you don't get the service you want, call me. I know who to call.
Okay.
So we need to do that as, first of all, within our local, our neighborhoods.
Okay.
And there's no physician, no nurse, no medical lab scientist, pharmacist, physiotherapist that cannot do that. And that starts the discussion going. That improves health literacy.
So, for instance, government funding. We have the federal.
Of course, we have this, local government. Yeah. And federal takes care of the tertiary hospitals, and state takes care of the general hospitals, and local government, the weakest arm of government, is taking care of the most important.
You're on the grassroots. Do you think this is actually still working? I know you're always out there.
Martina.
Dr. Alero.
You're asking me a jam question again.
Okay, now don't ask me.
Well, let me put it like this. I can speak authoritatively for Lagos.
Okay.
Lagos State, that is. And maybe a couple of other states where I'm getting very, very good reports, but I don't want to name them here because, you know, that it is working. You know, and even within Lagos State, as in all those other states, there are pockets.
Working, you can as well go ahead and call the other state that you think are also working.
No, because I live here, that's why. Okay. Those ones are third, you know, they are, what do you call it? What do the lawyers say? That's hearsay evidence. So hearsay evidence, this one this is evidence-based that I'm talking about. So I'm living this experience, so I can speak authoritatively about Lagos State, but I would not presume to do so until I have
the figures.
No, people from those states also saying who can also come and sit down beside me here and testify. But the point is that even within Lagos State that I boast is working, there are pockets where it is not working.
Sure.
You understand what I'm saying? And this is the same all over the country. So you have areas where, yes, they will boast and say, yes, it's working here. And within that same state, some areas will say, how come? What did you do? What not? For a variety of reasons. But one of the underlying things is this, what I said. Health literacy. Do the people know what is due to them and therefore make a demand for it?
Okay. Now we have already talked about the barriers. How do we solve the barriers?
These are how we solve the barriers. These are how we have to ensure health literacy. And that starts right from primary school, right from our basic primary education. Strengthening it so that children are even taught what needs to happen. Even simple things like we said, hand washing, refuse disposal, sanitation, toilet habits, and are taught all those, how to keep them. Simple things, but they go a long way to reducing. Then they are taught simple, you know, all the way through to secondary school. Even if they go into the arts and humanities, there are certain scientific things that they know that they cannot depart from. The importance of vaccination and immunization, the importance of screenings and other preventive actions can be taught to everybody. The importance of a good diet, the importance of physical exercise, the importance of constantly checking your blood pressure, your blood sugar, or your eyes, the importance of annual medical screenings. These are habits that we inculcate in children that as they grow, they will not depart from. That's health literacy. So anybody should be able to say, this is not normal. Let me go, and this is where I need to go to check it out. That's health literacy. So when we come to that, another big thing we need to talk about is we need to have intersectoral collaboration. We need to have housing, talking to agriculture, talking to transportation, talking to security, talking to education, before ever even we get to health. That needs to happen. We need to have that so that even if public health is on everybody's agenda, everybody is still taking their area and not crossing lanes into other areas to cause confusion.
True.
Do you understand? Then we need to have the issues of health inequities. Everybody, so inequity is different from equality.
Sure.
Inequality.
Yeah.
So whether you like it or not, women and babies under 5 do need a lot more access to health care than young, strapping, muscular men in the prime of life, who hardly ever get sick. In fact, remember, Dr. Martina, I told this story before. Women, you get pregnant. First, you're having your blood pressure checked. You're having your urine checked. You're having your... What was the discussion we had even before we came on camera? The woman has got her HIV status. She has got this, she has got that. As she's taking the baby for immunization, she's checking this, she's checking that. So, she's actually being educated almost subliminally about health and health things. Her husband, her brother, her father, they're busy bringing home the food for everybody to eat. And I remember a very sad situation when my husband, of course, he's a neurologist, had a patient, a young man who had suffered a stroke. And the mother was there weeping and wailing and wringing her hands. Her son, who has never been sick one day in his life, has never gone to hospital one day in his life. And my husband put his hands on his head and said, how I wish he had to go to hospital, even if for a football injury, so that they would have checked his blood pressure. Had they known he was hypertensive, they could have managed him, and maybe we will not now be at this where we are today. So that is what we are talking about. The men don't have as much, or don't get as much access to health care, and even when they do, how long does it take to check blood pressure? How much does it cost? Whereas the women need a whole lot more. So you now look at the vulnerable subpopulations within a population. Who needs more health care? And unfortunately, we know this is a global fact. The poorer you are in household income, the higher your need for health care. True. And yet, those very same people who have the lower household incomes have lower still access to healthcare.
And they're the ones that don't even have insurance.
They don't. So we're talking about insurance as well, which brings us into the finance and economic aspect of public health.
Wow. Dr. Alero, maybe you should just, in summary, all that you have said, how do we solving these problems? First, identify the problem, then identify the indicators of the problem, define data find the data for the indicators, right? In stages. Wow.
Yeah, but you're talking as if everybody listening to us is an academic. Majority of the people listening to us are not academics. And we don't even want them to be academics. Leave the academics to solve the highfalutin problems. What do we, as the common man, bottom of the pyramid, need to do? We need to first of all ensure that everybody understands that public health is a problem-solving activity.
True.
And everybody needs to get involved. Let me be honest with you. From as simple an activity as not throwing plastic rubbish into drains is a contribution to everybody's public health.
True.
As simple an activity as that. As simple an activity as hand washing every time you use the toilet. As simple an activity as refusing to engage in open defecation.
True.
Simple things that we can all do collectively to ensure that our public health, that we're addressing those challenges. Before we even talk of, let's talk of strife and conflict. Dialogue to resolve conflicting issues. we can go on and on, Abi.
Okay.
We've run out of time.
Yes, my director is just signaling. We've actually gone out of time. But I know I'll call you back again so we can continue. Thank you so much for always responding to my messages, inviting you for our program. Really appreciate you. And I want to also thank you on behalf of our audience. They always ask, please, where is Dr. Alero? Always tell her that we love her, that she's doing
I'm so thankful.
Really appreciate you. Thank you so much for being our program, our guest. And to our viewers out there, I'm sure you've heard so much from Dr. Alero today, where we talked about public health as a problem-solving activity. We talked about the barriers for effective action. You know the basics. Just ensure you wash your hands regularly. Look for the primary health care around you. Know your local government chairman. Then, if you have a challenge, let's call them out so that they can do what they need to do, because we must get it right. Thank you so much for being part of our program again. And always remember to follow us on our social media platforms, Instagram, Facebook, YouTube. If you want to be part of this program, just a click away. Go to our website and just complete the form. And like Dr. Alero, you come here, you have the opportunity to also speak to the public. Thank you again and remain blessed. My name is Dr. Martina Agbere.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.